Welcome to the Memphis Fitness Collective. I'm your host, David Allen, and on this podcast, I'll be connecting you with the best of the Memphis health and wellness community. Before we dive in, make sure you're subscribed to the podcast and check out our website, www.memphisfitnesscollective.com, for all the latest episodes and links to all of our guests. That's memphisfitnesscollective.com. Let's begin. Welcome back to Memphis Fitness Collective. I am here with Jared Worthington of Worthington Chiropractic. Welcome to the podcast, Jared.
Thank you for having me. We're excited to have you here and touring the clinic, and we're excited to do this.
Awesome, man. Well, first, tell me the story, how you got into chiropractic, what interested you.
Okay, so originally when I was in high school, I was wanting to go into pre-med or physical therapy. I was wanting to work with athletes, as I was an athlete in high school, football, basketball, track. And I thought working with athletes would be cool, but I wanted to be in healthcare. And I ended up having my own back injury in football, and my grandmother told me that I should probably go to a chiropractor. So I went to a doctor here in Memphis, Dr. Ken Clennon, and after touring his practice and watching his interaction with the patients and then receiving my first treatment, my first adjustment, I knew exactly what I wanted to do for the rest of my life, because I felt, I've never felt that good before. And I started to go to him and I started to perform better. I noticed it made a big difference in how I played football and how I was just, my posture, everything started to improve. So I did research and what I had to do, and I learned, yeah, you have to go to school even a little bit longer than even medical school. And but I was able to work with people with my hands and treat people naturally and get them well. And we're not, out here curing cancer or anything, but we have our own niche and our own lane, and we work hand in hand with medicine still today. But I felt like chiropractic was the best place for me to be able to, like I said, use our hands to restore the motion in the spine, to optimize bone positioning, to get pressure off nerves and let the body heal itself like it's designed to do. And hopefully, as time goes on, more people understand that might be a better option to start with.
Yeah.
Yeah.
But tell me a little bit more about that. What is chiropractic care?
Okay. So chiropractic care is holistic medicine. It is well over 100 years old. And it has all now evidence-based, peer-reviewed, and proven to work. And what we do simply is someone comes in and they have an issue, and we sit down and we talk to them. We do a very detailed, comprehensive history, a neurological and orthopedic examination. We shoot digital x-rays on most patients, and we formulate a comprehensive plan for them. And outside of prescribing medicine, we feel like we can address a lot of different problems. Medicine is very necessary, but sometimes I feel like it can be overprescribed.
Yeah.
And I'd just like the opportunity to be able for more people to come try us first, and then us be able to refer to those out to those other type of physicians when needed.
Tell me about schooling for chiropractic. What does that look like?
schooling.
Mhm.
So you have, it's just like medical school. The first 2 years of chiropractic school are pretty similar to medical school. And the last two, you're having more hands-on treatment, more learning how to manipulate joints in the spine. We end up actually with about a little over 300 more than a medical doctor or a DO. But it's kind of a misperception. I think a lot of people don't know. A lot of people assume that a chiropractor just cracks backs,
Mhm.
or it's just for pain relief. But there's a lot more anatomy, physiology, radiology, and way more in neurology that we get. But we get a lot less in pharmacology. So that's where the 8 years total equal out. But yeah, we are doctors of chiropractic, just like physical therapists are now being classified as doctors of physical therapy. Very similar field to what we do, but we each have our own lane for it.
Yeah, very cool. Okay. Um, so like what made you decide to start a business in chiropractic care?
Well, starting my own business here in Bartlett has always been a dream of mine. I was fortunate enough after graduating chiropractic school to come back to my hometown and to work at some great practices. I spent most of my career at a wonderful practice here in Bartlett that's, I believe, almost 45 years old. So I learned a lot from them of how a business should be run. And I was just in a great place to hone in on my craft and learn how I wanted to run my own. And then I felt like it all happened in God's timing. It wasn't my timing. It was things happening with, family, some curveballs thrown our way. But we remained stayed steadfast, and we had faith that it was going to work out, and we had to take that leap of faith and take the risk in starting our own practice. We had to go get a business loan. We had to do all these things
Mhm.
that, could have been detrimental if it didn't work out. But once we stepped out and took that leap of faith, it all came to fruition, and we started fast, and we haven't stopped. It's growing pretty quickly, and it's what we prayed for, and we just hope for it to continue.
That's awesome. Tell me about your vision for your clinic. I think it was like really cool to hear how your big picture of what you want to do here. So can you share that with everyone as well?
Yeah, I kind of wanted to think outside the box for chiropractic, and a lot of chiropractors, practice, only chiropractic, and we wanted to be more of a fully multidisciplinary, medically integrated, even um, whole body approach to having this clinic. And we have the space to do it. We've still got to grow into it, but I want to incorporate massage therapy, physical therapy, dry needling, electrical muscle stimulation, ultrasound therapy. We have a spinal decompression table, a Triton 6M spinal decompression table. So it's a state of the art table that literally pulls you apart in a good way. um, and we've had a lot of good success with that. We have shockwave therapy, which I don't think many people in town have. And that is a really cool piece of equipment that I'm very excited about, as it literally uses acoustic sound waves or ultrasound waves to penetrate deep into the muscle, tendon, or ligament to break up adhesions, to improve microcirculation, to break up calcific um, tendinopathy, to break up scar tissue even, and it stimulates the body's natural repair process. And it can be treated for plantar fasciitis, knee arthritis, piriformis syndrome, the full spine, rotator cuff injuries, calcific tendinopathies, all these different type of treatments, all these different type of ailments and pains that people have. We can treat all that. And I think a lot of people perceive chiropractic as being only the spine, but we work on the whole body.
Yeah.
Along with those treatments, we also have laser therapy too, that we usually follow up the shockwave. After shockwave, we'll use laser therapy, and that is, if you remember sixth grade biology, like I was telling you earlier, there's the mitochondria in the cell, the powerhouse of the cell, where that laser will stimulate the mitochondria to allow the cells to rush to the area to help the body heal faster. So all these different type of therapies we want to incorporate. We even have nutritional counseling and lifestyle modifications, um, and even a bigger picture for the future. We're not there yet, but I would love to make our clinic medically integrated. I would love to find a wonderful nurse practitioner or a medical doctor, even to work hand in hand, so that we can, do the medical thing the right way.
Yeah.
And be able to, learn from each other, and it be a one-stop shop here.
Yep.
We even have room for a physical therapy bay in the back too. So we could just be, multidisciplinary approach.
Yeah. I love that. It's kind of recognizing that all these different disciplines and tools work together. Is more tools in the toolbox to fix the problem, right?
Right.
Talk about, chiropractic care is kind of known for, spinal manipulation, joint manipulation. Can you talk about that? What is occurring, like when you're manipulating someone's spine? Like what happens when you hear the pop? What is that? What is occurring?
Yeah. So a lot of people assume that when they hear the pop, that's bones cracking. And it's more or less restoring motion into a restricted joint. You can't pop your own back. You can't adjust your own neck. When you do, it literally can be pushed in the wrong direction. You're going to hear that pop. It's going to release that nitrogen gas. So you're gonna feel the pressure release, but it's not what we're doing.
And is that gas just in that joint? In that joint capsule, or just in between those bones? Is that where that nitrogen gas is?
Yeah, it's in the cartilage. So it's in between the bones and it's cartilage, and it's a pressurized system.
Yeah.
So that's why Grandpa always knows when it's about to rain, because the hydrochloric pressure environment changes and the arthritis acts
The
up.
pressure in his knees.
The pressure
pressurized.
in his knees pressurized,
Yeah, okay.
and it starts to get more pressurized and it hurts.
That makes sense.
So we find out what's not moving correctly through our examinations and everything, and we feel. And it's very high velocity, but low amplitude thrust. So it's quick but gentle, but it helps restore the motion into the spine or the joint in the right direction, where it will go right past the paraphysiological joint space. It's going to hear a pop. And that pop is just that gas being released. But what's really happening is that joint is getting blood flow to it now. It's kind of like an oil change for a car. Right after the adjustment, you're probably going to have more range of motion. When you're used to getting adjusted, you feel way better right away. In the beginning, your first adjustment in your whole life, you may feel better when you leave, but you may be a little sore that night. Because when we adjust you and blood rushes into that joint, what's going to follow it is inflammation.
Yeah.
And inflammation, as simple as I can put it, is warm liquid toxin. So ice packs are your friend. You want to put ice on it in the beginning when you're in that inflammatory phase. Once we start healing and you get out of pain, you get more into that rehabilitative phase, and you can use heat on it and stuff like that. So in the beginning, we want to put pressure, restore motion in the joints. Over time, you have to keep pushing it in the right direction. A lot of people assume that, once they're pain free, they stop coming here. And one of the misperceptions is if you go to a chiropractor, you have to keep going back. And that's not true at all. We try to get people once they're going through a maintenance phase and once they're pain free, yeah, we want to see them at least once a month, but that is for maintenance care. You stay pain free. We teach you how to, do physical therapy exercises and home exercise programs at home for free and be able to be healthier that way.
What's causing that joint restriction? So, I mean, someone's like, I got this pain here. You're going and feeling like, all right, this joint is not moving through the range of motion it should. What causes that lack of range of motion?
It's misaligned joints, poor posture, especially they've got x-rays and MRIs of back in the 80s versus now, and you can see the spine evolve because of cell phones and computers. We're all in this posture, and our cervical curve is starting to reverse that way. And it's gonna get a lot worse in the future because of all the technology and more people are at computers all the time in this T-Rex posture. So it's very important to focus on keeping your chest up and your shoulders externally rotated and your head retracted and tight here and holding the pelvic floor muscles up. And all these different things that we can teach our patients how to do. They're very simple, but it'll prolong the hygiene or the health of their spine.
So essentially, their body's just adapting to lack of proper movement.
Yeah.
By restricting movement.
Yeah. And when the most improper movement is going to get more improper quicker. So it accelerates exponentially and gets worse. And it's degeneration. It's osteoarthritis is regular arthritis, which usually scares people. But I mean, if you're over 25 years old, 30 years old, you're going to see arthritis on an x-ray.
What is arthritis?
Arthritis?
Yeah, what is it?
Arthritis is inflammation of the joint. Arthros means joint, itis means inflammation.
Okay.
So when your joints start to degenerate, you're going to develop inflammation, and that's going to cause all these little chemicals to run in there and cause pain. The bones are rubbing together, and you don't have enough space for the nerves to move freely.
It's extra fluid inflammation in the joint that restricts joint movement.
Yeah.
Causes pain.
Mm-hmm.
Maybe even do the chemicals also cause like tissue damage, like like degeneration of cartilage, bones, all that within there.
Mm-hmm.
Okay.
Yeah. There's chemicals like substance P. There's all kinds of different. I can get all scientific with it, but there's these little chemicals in there that will cause that to deteriorate.
They're like breaking down your cartilage, maybe breaking down some of your bone tissue.
Yeah, the joints and the muscles get sick, and they have all these the bad chemicals, which is why we incorporate shockwave therapy, laser therapy, and dry needling.
Yep.
Because especially dry needling is even a more simple technique where we're using a filiform needle, kind of like an acupuncture needle, but it's not acupuncture.
Mhm.
Acupuncture is Eastern Chinese medicine that's very highly researched to work for a lot of different things, but dry needling's different. It's more new. It's more modern for professional athletes, college athletes, and people that do what you do when you're treating your athletes. The needle goes in and hits what's called a neuromuscular junction. It hits where a nerve's attached to a muscle. If that nerve has inflammatory chemicals called bradykinin and substance P, they'll go down that nerve, they'll land on the muscle, they'll swell up into this big ball of swollen tissue, and it hurts. And you can find it with your hand, but then you use the needle and you hit that, and once it hits the nerve, it's going to make a local twitch response, or an LTR, and that's the muscle releasing, or the trigger point releasing those bad chemicals back into your bloodstream.
Interesting. And it's that muscle firing that causes that to release back into circulation.
That twitch response is it releasing the chemicals back into the bloodstream. Your lymphatics can filter it out, but it is causing what's called a histamine response. And people think of histamine, they think of an allergic reaction. So the skin around the needle turns red, and then you wind the needle, which sounds gross, but it creates a bigger lesion in there, which will wrap. It's like spaghetti around a fork. It'll wrap the tissue, the fascia, the muscle around the needle, create a bigger hole, which invites a bigger immune response. So the white blood cells rush to the area and they heal it. And then if there's 4 or 5 needles in there, we'll hook it up to electrical muscle stem, and the whole area will be twitching. Like you just saw when we did one back there, and her arm was twitching.
Is that doing the same thing? That continued twitch is allowing some of that inflammation to release back into circulation.
Yeah, it amplifies what the dry needling's already doing, but it also releases your endorphins and enkephalins, so your natural painkillers.
Mm-hmm.
So most people have heard of endorphins. So when you're doing that, you're going to release endorphins, and it can help with the blood flow. And dry needling also causes probably 48 to 72 hours of soreness if you've never done it before. It's called a process called angiogenesis. It's the repair of arteries, veins, and capillaries, and it usually takes about 48 hours. And people can be a little sore, but the range of motion usually improves instantly.
I remember my first time getting dry needling. We're like, what the hell was that?
Yeah.
But having like amazing release. Like that first little twitch, like, whoa.
Yeah.
What was that?
Yeah. So dry needling can be a little painful. But as long as it's explained right, and the doctor is talking to the patient, making sure they're comfortable. If it's too much, we pull the needle right out, the pain will go away. But we do want to keep hitting it while it's still twitching until it stops twitching, and then we know we've got it out of there.
Well, I think that was kind of like what I eventually realized was the more it twitches, the more relief I seem to get.
Yeah.
Like if I hit, you get a spot where it's like, man, this is just continuing to twitch. There's extra relief from that.
Which is the coolest thing about dry needling. It's like the only type of therapy that is diagnostic and therapeutic at the same time.
Yeah.
So it's like you're getting the twitch, which means you're hitting the problem, but it's also what the problem needs.
Right.
All at the same time.
Yeah.
So I think that's the cool thing about dry needling.
All right. So talk to me about like what the process is. Someone's gonna typically come to you for, I have some type of pain. So let me go through this maybe step by step. What are like the most common pain points that you see in your profession?
Most common would be neck and low back pain and headaches.
Okay.
We treat headaches all the time, neck and low back. People come here because they think of chiropractic for that
Right.
thing. They don't think of it, the elbows, the ankles, all the other things we do. They don't usually think of that until
Right.
after the fact. But the most common would be the spine.
Gotcha.
Neck pain, headaches, low back pain, sciatica.
And so you then, okay, cool. We're gonna do maybe an X-ray next.
Mm-hmm.
And what are you looking for in that X-ray? And is that typically showing something is that typically showing what the root of the pain is? Or is that just kind of, hey, we're just double checking to see that there's not anything,
Yeah,
crazy underlying here?
Yeah, all of the above. So first off, if anybody's over 50 or 55, I'm usually always shooting x-rays.
Yeah.
I usually shoot them anyways, unless it's a very mild condition. It's a young person. There's no underlying history
Yeah.
or some people, save a little bit of money and you don't need to get the x-ray. But most people, we're going to shoot them and we're going to get a base of the symmetry of the spine. We're going to look at the bones, the cartilage. But we're going to see what level of degeneration is in there. What if any of the discs have deteriorated. But yes, there's been times where we found cancer on an x-ray. So that's never a good or a fun conversation, but every patient we've ever found cancer has always been appreciative that we found it, and we send them to oncology and they find it early.
You've seen a tumor somewhere in the thorax?
Yeah, we've seen tumors in the thorax. I've seen tumors in the prostate. You've seen tumors in the neck.
Wow.
But yeah, that's something that as a chiropractor we don't see often.
Yeah.
I might see that once a year.
Yeah.
But we do, especially over a certain age, that stuff can be found, and why not shoot an x-ray?
Yeah. Does the x-ray typically show a joint that lacks mobility? Or does that have to come through a manual test? Like, are you going to see there's a joint, can you see a joint that's, I understand you might see that's out of place or not in proper alignment, but can you see if it lacks mobility or are those the same thing?
We can see that it probably lacks mobility.
Okay.
But a functional movement screen is also necessary. Yeah. So the x-rays are good to say, you probably got this problem here, but let's start moving. Let's do an orthopedic test. Let's do neurological tests. Let's see if all your sensation is good, you're numb or tingling anywhere, if you're weak anywhere, or if your reflexes are diminished. We know what condition neurologically that might be. But x-rays don't show everything. Yeah. So there's, if you've got a disc herniation or a disc bulge, we would typically need an MRI to diagnose it. Right. But the x-ray can show that you might have it. Right. It can show that it's probable. And then also with the movement screen and the orthopedic test, you can probably diagnose this is probably a disc herniation or a disc bulge, and we can treat it as such. But the x-rays are limited in like certain soft tissues that only MRIs can see.
You're just kind of creating layers of diagnosis.
Yeah, differential diagnosis. Yeah. So it could be you just kind of break it all down from abroad, and then you find exactly what it is. And many people have multiple things.
Yeah, that makes sense.
Yeah.
All right. So talk about maybe how some of the treatments impact each other. Because I imagine I've always kind of in my head said, hey, bones don't move themselves, right? Like they gotta be attached to something. Mm-hmm. So talk about maybe how you combine a treatment that like dry needling or shock therapy with chiropractic care.
So why would we combine them?
Well, yeah. Also, why? I kind of understand it, but I think it'd be helpful for other people to understand. Hey, why would it be helpful for me to go to a chiropractor who's not just going to just do spinal adjustments, who might also implement some massage therapy, dry needling, shockwave into joint manipulations?
Simply because I think you're going to get a better outcome by treating all these different problems. And by having the multiple little sections and areas where we can, you got this going on, well, we can do this, but I've got this therapy for that. And we treat the whole body versus just the spine. Now, the spine's the most important because everything is controlled by the nerves. Every organ, system, tissue, cell in your whole body is controlled by the brain, brainstem, and spinal cord. And then you've got these little holes, these little nerve roots that come out that go down your legs and down your arms and down to your digestive organs and lungs and heart. And if you keep everything in proper alignment, you're more likely to have healthier organs too.
Yeah.
So it's very good to do all that. But in terms of why to use these other therapies is, for one, it's going to be cost effective. It's not going to be much more financial burden, but it's all in one house.
Yeah.
So I wanted to, since we had the room for it and just thinking outside the box, let's get some therapies that can treat as many different conditions as I can think of. And then, because the last thing I want to do is know I can help someone, but just not have some basic equipment that can do it. Yeah, we have all those tools now.
No, it's fair to say that it brings the option of faster relief or more comprehensive relief.
Yeah. Definitely faster with things like the decompression table, the shockwave, and the laser. People are getting better very fast.
Yeah.
Now, typically people get better pretty fast with just spinal manipulation, just the adjustments.
Yeah.
Average patient, depending on what's going on, but average patients are usually pain-free in 2 to 4 weeks. Problem is, a lot of them stop at that point, and then they come back 2 months, 3 months later and asking why they're hurting again. So it's like, maybe I need to do a better job of illustrating the importance of the entire plan I'm trying to build out. But people usually, a lot of people want to come in only when they're hurting, but and we're here to do it.
Yeah.
But that's, we really encourage people to be on a maintenance plan, and that a lot of times for a lot of people is once a week. It's every 2 weeks or once a month. Even a little kid, I say, bring your little athlete, and he's 10 years old, come here once a month for a tune-up. It's very good for their spine, because as their spine might be developing scoliosis, it hasn't fully ossified yet. We can help change that curve in a young spine and prevent them from having this aggressive scoliosis that might need rods and screws when they get older.
Interesting. So, a little personal insight. My wife had Harrington rods from scoliosis in 8th grade.
Yeah.
So that generally could be preventable through chiropractic care at an earlier age.
Potentially.
Yeah, potentially.
Yeah, because when we get, at a certain age, our joints and our spine starts to more ossify more. So you can't change that curve as much. And you can get people out of pain and change the symptoms, but that curve is much harder to make much of a difference. But when they're young, and you spend 3 months with a young person, and you can see a big difference on x-rays sometimes.
But what does a typical protocol look like if I came in with some neck pain? What are you seeing as necessary treatment frequency? And then how does that then change how does that adjust as you move into a maintenance phase? For example, is it 3 times a week? For how many weeks? 2 times a week? Paint that picture.
Here, every patient is different. On average, somebody who's in pretty good pain, I'm going to see them a couple days in a row.
Yeah.
I'm going to see them 2 or 3 days in a row. Most patients that have pretty decent problem, we're going to see them 3 times a week for the first 2 weeks. I like to just leave it at those 2 weeks and then adjust accordingly.
Yeah.
The most common would be 3 times a week for 2 weeks, 2 times a week for 2 weeks or so, and then once a week. And as long as you're staying pain-free, we taper you to every 2 weeks.
Yeah.
And the only reason for that every 2 weeks is financially.
Yeah.
I mean, to budget coming in, but everything we do is at a heavily discounted in terms of the average rates for Tennessee. We do everything lower, trying to make it a more accessible.
I mean, can you do too much chiropractic care? If I have unlimited time and resources, I want to get adjusted every day or twice a day.
For some people that are hypermobile, that don't need extra manipulation, yes, you can do it too much. But I haven't really met anybody that we're just getting adjusted too much.
Okay.
I mean, there are people that are here all the time. I mean, there's the people that are here. We have a lot of people that come every week.
Yeah.
It's part of their life. It keeps them feeling good once
Yeah.
a week. It's rare that we have somebody that's coming in here 3 times a week forever.
Would there be benefit from that? Or, if financially it was viable, would there be benefit from just, hey, just getting manipulated that often?
It depends. It depends if the person had. I wouldn't think 3 times a week forever. I think that would be kind of an overkill.
Yeah. Wait, would it be that, hey, like you're in alignment, there's nothing to,
Yeah,
it's like you haven't gone back out of alignment yet.
if it's been a day, I will find stuff to adjust.
Yeah,
like
okay.
your pelvis out of alignment with a drop table. We're going to correct that.
Yeah.
And we'll find stuff to move. But you don't want to move a joint that's moving too much.
Yeah.
So that's why when we're about to adjust people, we palpate which joints are moving good. If everything's moving good, I usually leave it alone.
Yeah, we're good to go.
Yeah, I mean, I usually leave it alone. There's always going to be something to do. But if someone's in here that much, but we don't usually have people like that.
If someone came to you with a pain issue, like, hey, like 3 times a week, I think this is gonna be best. And like, I can't even get out here, and I'm limited time or budget wise. Like, but I can't do once a week. Can you still see similar results? It just may just take a little bit longer, or is it like, man, if you're not getting it that frequently enough, it's not gonna really hold?
100%. You'll still get there.
It just take a little bit longer.
It just takes longer. Yes.
That makes sense.
Yeah. And you know, people. But the issue is it's a psychology thing. People expect when they're coming here. And I try to tell them, if you're coming here once a week, it will take time.
Yeah.
I mean, even if we add decompression and all these other things in, it's going to take a lot longer.
Yeah.
The body, you know, there's studies that show it takes almost 90 days or 3 months for certain tissue to change. You roll your ankle, I mean, you might get out of pain in 6 weeks, 4 weeks, but it's going to take about 3 months for that to completely repair. So we need to be doing stuff to that ankle for that amount of time.
Yeah.
I mean, even if it's once every 2 weeks, it needs a little tune-up.
Is it possible to have like perfect alignment? Like, is it possible to not be misaligned?
I've never seen it. I mean, like I said, there's always something to adjust on anybody.
Is it just like
anybody and everybody could use chiropractic care.
Yeah. Is it just that the body, it's just like, hey, it just adapts to the environments it's put in. It's constantly adjusting, and this thing doesn't move and this one does, or this one moves too much and this one doesn't move at all.
Yeah. Like just like a muscular imbalance. You know, somebody's got tennis elbow, they probably have their extensors are too strong and their flexors are too weak.
Yeah.
You know, I mean, you got joints that are moving really good, and right next to them they're stuck, or somebody has a spinal fusion.
Yeah.
And that joint's no longer there, so above and below starts to wear out and get arthritis earlier. So we need to be treating above and below anybody that has a fusion. Another thing that is a misperception, people that have surgical, you know, fusions and stuff like that, they're scared to get adjusted, but those fusions are concreted in there. We're not going to hurt them. We can't adjust it. It just is going to move above and below.
Yeah.
So, and it's very, very safe.
Well, can you talk to that? Like, I think there's some perceptions of like chiropractic care being maybe dangerous, you know, especially like manipulating the neck. Like, so good chiropractor, you're going to break my neck and I'll be paralyzed. Talk about that real quick.
So, and that's always one that I think every chiropractor has to defend, but we shouldn't have to, because there's one stat that we have on our side that kind of debunks all that. We have pretty much the lowest malpractice insurance of all types of doctors. So I guess I wouldn't say what my malpractice insurance is, but it's very low.
Yeah.
It's very, and most other types of doctors. And the reason for that is, you know, a lot of other doctors are prescribing medicine, and those can counteract, and there's surgeries, injections, and all these things that can cause potential side effects, but chiropractors aren't hurting people.
Right.
And if we were hurting people, our malpractice wouldn't be at the lowest.
Yeah.
So, I mean, that simple statistic right there kind of shows that is a myth.
Is there a risk to having your neck adjusted?
There's a risk to everything. There's risks, benefits, and alternatives to everything. The chiropractor would have to be negligent, and he would have to be, there would have to be an issue where, you know, he wasn't paying attention and he slipped and fell on your neck or something. But we are taught in school that, you know, there is it's so gentle, the adjustment. It's quick, but gentle. And I believe, don't quote me on this, but I believe the study of when you are getting your neck manipulated, you're putting 3 to 4% of stress on the vertebral artery. And when you are rotating your own neck to look behind you, you're putting 12, 13, 14% of stress on the vertebral artery. So it is physiologically impossible for a chiropractor to sever an artery with an adjustment.
Yeah.
Every single case that I have ever seen where somebody had a stroke or something like that happened, it always showed that person had a prior brain bleed.
Mm.
And that was what caused
Yeah.
it. They just so happened to go to a chiropractor semi-regularly.
Yeah.
It had nothing to do with the stroke,
That makes sense.
which is why we still have the lowest malpractice insurance, because that's all been debunked and proven.
Yeah.
But they have teams of lawyers out there that will chase down chiropractors and try to sue them.
Yeah.
And then they put this headline, the chiropractor caused the stroke. But if you read the fine print under the headline, the patient had a brain bleed, chiropractor didn't cause the stroke.
Yeah.
So, I understand you watch too many Steven Seagal movies or Jackie Chan, you're going to think that we're going to break your neck and scare you to death and the noise.
Is that possible?
So I get it. Breaking your neck?
Yeah. Is it possible for another human being to literally just
I think you could.
if you're strong enough and their neck's weak enough? Okay, fair enough.
Break my neck.
Fair enough.
Yeah.
What can you talk about chiropractic care in relation to like training? So, is it okay to train before chiropractic care or right after? Should there be any type of waiting period, or if I'm dealing with an injury, just kind of talk about that.
Again, it all depends, but definitely we want our patients moving.
Yeah.
We'd highly encourage exercise, going to somewhere like NBS Fitness, like your gym, working with a personal trainer, doing the movements the right way.
Yeah.
Even after dry needling, you want to move, you want to exercise, whether you get a massage or go exercise it out. You want to get that blood flowing, get all those toxins out of there. So we encourage a lot of people they'll come in here in their workout clothes. They'll have worked out. They'll come get an adjustment. After they've pushed stuff out of alignment from their workout, they want to get adjusted right afterwards. And same thing with getting an adjustment before.
Did you find it one thing works better than the other? Like, is it, if you find it better to work out and I'm kind of out of alignment, get put back in alignment, I recover faster, or I'm out of alignment, get put back into alignment, I go perform better?
I kind of like it when they've already worked out, because they've already done all those movements.
Yeah.
And then we can kind of set it and then let their body heal and relax. But there's things, like I said, like dry needling, where we encourage movement.
Yeah.
But it doesn't have to be, you don't have to go deadlift and squat after the adjustment. I would say do that before the adjustment.
Okay, fair enough.
Yeah.
Fair enough. Very cool. Any other insights to the chiropractic care that you'd like to share before we wrap this up?
I think we covered most things. One of the main things, and one of the biggest misperceptions is, what we want to get out to the public is, so many times, and I hear it on new patients every day. We see 4 or 5, even sometimes we've had 10 new patients in a day. So many of them have already gone down this whole route of doing all these other things before they come to us.
Mm-hmm.
And they have spent thousands of dollars.
Yeah.
But they still have the same problem. And I would want a refund if I was them, but we end up typically correcting that problem. And when we don't, I work with Sims Murphy. I work with Ortho South, Ortho Sport and Spine. I have other doctors that refer here, and I refer there for MRIs and nerve block steroid if needed. But we do try to stay away from those.
Yeah.
So this is what I hear most of the time when a patient comes in. They have already they go to their medical doctor, or they'll get referred to ortho or neuro, and not anti-medicine at all. I actually want to encourage medical medicine in this practice, but what I keep hearing is they have either gotten one of 5 things. They've gotten a muscle relaxer, or a painkiller opioid, or a corticosteroid injection, or a steroid dose pack, a nerve block, and then there's physical therapy. The steroid is going to decrease the inflammation, but when that chemical wears off, nothing got fixed.
Yeah.
And it can cause calcium deposits. It can weaken bone density if you use chronic steroids. The nerve blocks, it's gonna wear off eventually. People end up doing too much when they have the nerve block because they feel better, but then the chemical wears off and they hurt themselves.
Yeah.
Physical therapy is the only one of those 5 that is, I think, beneficial in the long run. But what happens, in my opinion, is people get prescribed PT when they still aren't moving right.
Yeah.
So sometimes those exercises irritate them. and then they come, they say, we did 6 weeks of PT with no relief.
Yeah.
So, and then they get the MRI consult, and then they get the surgical consult. And then finally their friend tells them to come see
Hey,
us.
before we cut you open.
Yeah, before we cut you open, why try the chiropractor? So what we like to do is once we restore that motion in that ailment, and we get everything in better alignment, and now there's pressure off the nerves, and now all the organs are happy, and the bone and everything's feeling better, then we like to incorporate physical therapy.
Yeah.
And whether we refer out for physical therapy or we teach the patients how to do it here. We have a program where we teach home exercise programs. It sends them a link to an app where they have videos of YouTube videos of how to do their exercises, so they can airdrop it to their TV at home and do their PT at home. And then it has a bunch of workstation ergonomics and nutritional counseling and all these other things that incorporate, and it's all catered to the patient. If you have an ailment, I'll put it into our system and I'll generate you a personalized plan. It's got your name on it. It's got a QR code for your own issues.
What do you feel? What's the typical relationship that you feel between like neurosurgeons, back doctors, and chiropractors? I mean, is it usually like a friendly, understanding relationship, or is it I don't believe in what you do and I don't believe in what you do?
Well, I wish it was a better relationship, but the ones that refer to me, they love it because they've had good success stories, and their patients have told them, and that's why some of them have started to refer to me. But I don't think it should ever be a belief system, because we know all of it works. They wouldn't give us a doctorate. They wouldn't give them a doctorate. Especially neurosurgeons. I mean, they do amazing things. I mean, they save lives every day. They do all kinds of stuff that we can't do. Every other type of doctor does stuff that a chiropractor can't do. We do things they can't do. But we all go to school for our own thing. And I just, I want to have enough humility to be like, I'm in my own lane. So I definitely believe and agree with a lot of the things they do. But I do feel like being a chiropractor, we do get, pushed to the side a little bit when you're not in that pharmaceutical realm. But that is changing a lot. I mean, the past 4 years, chiropractic has been catapulted into one of the fastest growing healthcare fields in the world. Physician assistants, nurse practitioners, and chiropractors, I think, are the top 3 fastest growing healthcare fields. So if we're in one of the fastest growing healthcare fields, we got the lowest malpractice insurance, what is there to lose by, trying chiropractic?
For sure. Yeah, I think it's maybe helpful for people to understand that, if you go see a medical doctor, they really only have 2 tools in their tool belt. I can either prescribe you medication, or I can do surgery on you. I can refer out to PT, but like we talked about, like PT is introducing movement potentially into a system that's not ready for that movement.
Potentially, but I think most PTs know what to do. So they do a good job, which is why I said that was one of the 5 things that I would encourage, because physical therapy is very in line with chiropractic. We do a lot of the same stuff. We're more of the spine specialist, and they get more time with the exercises. So, I'm personally seeing over 40 a day, sometimes around 50 patients a day. I don't have 30 minutes per patient like a PT might.
Right.
So their PT is more in depth, which is why we have the home exercise program, so people can do it at home, but they have to be accountable with our program. So
but I think
they do both.
It's helpful to, like, using that tool analogy to kind of understand, like, if I got to hang a TV, I typically need more than just a screwdriver.
Yes.
I need more. I need more tools. And so, to address, and I think we've, as a culture, we're shifting, but have been kind of told, you have X, you need Y. You have X, you need Y. You go to the doctor, tell them X, they're going to give you Y. And it's like, man, I just don't ever see it working that way. Typically with like pain issues, especially like orthopedic pain issues. If you have a cavity, sure, like we kind of know what to do there. But I see oftentimes that people have these orthopedic pain issues, and they get confused because I use this one tool didn't fix the whole thing. And it just may be that hey, you've got nerve pain due to something going on in your spine. And a nerve block may be helpful to help you function in like everyday life because you're in so much stagnant pain, or like or some type of opioid.
Mm-hmm.
But going to a chiropractor, it's like that helps you just function daily, but it doesn't address the issue. And you can go to a chiropractor who can then restore function to those joints the way they were originally meant to be there.
100%.
That restored function now allows you to move better and get some rebalancing of some muscle that is probably weakened and got an imbalance, either through self physical therapy or going to see a physical therapist. And the reality is, if you tried to use any one of those tools, you might not have gotten like the full relief that you were trying to get.
I think that's perfectly said.
Yeah.
You can get a nerve block and still come here.
Right.
You can come here and go get a nerve block.
Yeah, for sure. And it's like,
we'll probably be able to get more done while you have that nerve block in.
Yeah.
But if you only get that nerve block, that problem didn't go anywhere.
Yeah.
We will be the ones to biomechanically push the problem out.
Yeah. What I've seen is an issue in the last like 100 years with regards to the medical healthcare profession. And it is changing, thank goodness. But it has been the compartmentalization and segmentation of the body. It's like you do have a podiatrist who only focuses on like the big toe.
Yeah.
You know what I mean?
Yeah.
And is like an expert surgeon at the big toe. But it's like, that's not the way the body works.
No.
It starts
at the brain and the spine.
It's built up of many complex, interwoven and interconnected systems.
Absolutely.
And so when you segment it, it's no wonder that you're not getting like the results that you wanted to, because that's not the way it's made.
It's not the way it's designed.
That's not the way it's made.
And a lot of times it's insurance and pharmaceuticals.
Yeah,
I mean, they're married together.
Yeah.
And people are going to go with what their insurance pays for. Now, we are in network with all major medical insurances too. So, it's very affordable to go to a chiropractor, much more affordable typically than other types of doctors. That's another misperception. But sometimes it can be a small, it could be a couple $100 investment at first, but I have patients who have spent $10,000 on headaches.
Yeah, I was like,
and then they come here, and then we a couple $100, or their headaches are maintained and they're better. But you're exactly right about the healthcare model. And we just want to be in our own lane, but at the same time, we're raising our hand over here, like, guys, come on.
We can help.
We only see, I think, 20% or less of the population in the southeastern area of the country.
Yeah.
Like 1 out of 5 people, I think, go to a chiropractor, and there's a lot of spines out there that could be getting better.
Very cool.
In my opinion.
Okay, cool. So that was my final question. You guys do take insurance or cash pay if necessary?
Yeah. So we take all major medical insurance. There's Blue Cross Blue Shield, United Healthcare, Cigna, Aetna, Medicare, and Better. There's a bunch of different ones that we do take. We have a billing team that helps us do that. So we try to make it accessible to anyone and everyone.
Awesome.
And even our self-pay rates are at a discounted rate per what Tennessee is.
Yeah.
The average in Tennessee. So we make it affordable for everyone. And we can address many issues, and the easiest way to find us is look up Worthington Chiropractic. I highly encourage people to look up our name and search through the Google reviews. Read our patient testimonies. Not trying to boast, but we have been open 11 months now. We're going to celebrate our 1 year next month. We're going to have a patient appreciation day, an open house for the public and all our other patients to come in and treat everybody at a heavily discounted rate, just to say thank you for this first year in business. And we want to invite anyone and everyone to that open house. We're going to do some promotional things. We're going to give away raffles for free sessions or discounted sessions on shockwave therapy, spinal decompression, laser, and all full package of everything that we do. But I also want to encourage people to look us up, look at our website, check out the Google reviews, read what the people are saying around town. and give us a try. Our number is 901-519-47s. So 901-519-7777. And you can also find us at worthingtonchiro.com and Facebook at Worthington Chiropractic Bartlett and Instagram at worthington.chiro_.
Awesome. Well, thank you, Dr. Jared, for coming on the Memphis Fitness Collective, and we'll see y'all later.
And my pleasure. Thank you.
This episode is brought to you by MBS Fitness. MBS Fitness is the best gym in Memphis. They've been helping Memphians achieve their health and fitness goals for over 15 years through personal training, group training, and health coaching. And if you mention this podcast when you sign up for one of their training services, you'll get a free health coaching session. That's a $150 value for free. You can learn more from their website, www.mbsfitness.net. Check out their locations, services, and testimonials. And don't forget to mention the Memphis Fitness Collective when you sign up. mbsfitness.net, Memphis's best gym.